Okay.
Hey, okay.
Okay, can you see my slides?
Yes, sure. But just let me give a quick biography of you so that everyone get to know you.
Yes,
Sure.
thank you.
Okay. Dr. Pilla, PharmD and PhD, received his master's degree in pharmacy at University in Chieti, Pescara, Italy in 2005, where he also served internships at the Cell Psychology Laboratory and the Molecular Biology Laboratory. Prior, he was an Erasmus student at Faculty de Pharmacie de Reims in Reims, France. He received his doctor OPS in 2010 from Petit Salpêtrière Institute in Paris, France. Also in 2010, he received his PhD in biochemistry, physiology, and pathology of muscle at GD University in Chieti, Pescara, Italy. He was hired as a postdoctoral scholar in Department of Pharmacology and Physiology at the University of South Florida in Tampa on 2 research grants funded by the Office of Naval Research, U.S. Navy, and Drivers Alert Network. He was written and lectured widely worldwide. He has been involved in ongoing research in University of South Florida with the use of ketone esters. Okay, the title of his speak today is Therapeutic Ketosis and the broad field of applications for the ketogenic diet, ketone ester applications and clinical updates. Okay, yes, please start.
Thank you so much for the presentation. It's been very, very kind of you. Today I'm going to talk about the benefits of ketosis. Hopefully that'll be an interesting topic for all of you in the future. I mean, usually that fits pretty much in every conference, every webinar, because there's a lot that relates to health in general. So I'm gonna get started with my personal story. I started research in Italy. Then I moved to France for my PhD, and then moved to England for a little period of time, and then back to Italy, and finally did my postdoc in the United States, in Tampa, Florida. And this is where my story begins. I started my postdoc at University of South Florida in Tampa, Florida. I got a grant. I used to work in a grant with the U.S. Navy, with the Navy SEALs. So basically, what do these guys do? They take care of military missions, attack defense missions, submarine rescue, and so forth, as you can see in these pictures. But notably, the agency that is responsible for the section of research for the Navy is called the Office of Naval the Gas Palace, which was a backyard with a number of tanks that we used the Navy, the Navy SEAL deep dives. So as you can see in these pictures. The reason why it was called to work in this, and if there was any physiological marker to predict the onset of seizures, because this used to dive and they had problems. They had seizures like in epilepsy, and there were a lot of them that used to die. I'm talking about the 60s and the 70s and the 80s. So this phenomenon brought the US Navy to study the phenomenon to understand if there was anything that would avoid these people to die. I don't know if you're familiar with diving. I'm gonna just give you a quick set of information just to give you a brief idea of what we're talking about. As now, we are breathing about 21% oxygen and about 79% nitrogen. Now, as we don't go deeper, there's no problem. The oxygen is perfectly metabolized by our body. The nitrogen is in inert gas, so it is not metabolized at all. But if we go deeper, it gets accumulated into the tissues. And if we go, as we surface back, we need to allow the nitrogen to get eliminated by the tissues. If we do not go slowly up, we risk to accumulate it into the tissues, and especially, best case scenario, in the joints. And in the joints, the maximum that could happen would be, just pain, deep pain. And so we have to go back in the hyperbaric chamber and then everything is set. Worst case scenario, that can get accumulated into the optic nerve, for example, and make us blind, or it can accumulate into the spine and make us paralyzed. It can make a lot of things. So that's a good, good deal is to surface as low as possible following the safety measures. The problem is that if we do not do this, because we can't, if we're on a military mission, we are stealth and we need to surface as soon as possible, we might have these problems. So the Navy back in the 70s started to use higher amounts of oxygen to kick off all the nitrogen. So not 21% anymore, but progressively 30%, 33%, 36%, up to 100%. This had a lot of advantages. Number one, we didn't have any nitrogen anymore, so no need to do the safety stop as we surface. Number two, that they could stay longer at the bottom during the dive. And there's a lot of other benefits, but the other side of the medal was that all these amount of oxygen at higher pressures would generate reactive oxygen species and then cause what we call seizures. Central nervous system, oxygen toxicity, seizures. This can happen in two conditions, one using a hyperbaric chamber or during a deep dive with a rebreather, as you can see in the picture on the right-hand side. Anyhow, I'm going to show you very quickly what a seizure under the water looks like. Of course, this is not under the water, but it mimics the environmental conditions of the water. It is in a hyperbaric chamber at 2.8 atmospheres, which means about 40 meters of deep sea water. What happens in this case is that the guy on the left is breathing pure oxygen, the guy on the right is breathing air. So the guy on the left is telling the guy on the right, who's the physician, please, I want to take off my mask because I don't feel well, I feel dizzy. So they take off the mask, but still he had a lot of reactive oxygen species attacking pretty much his brain. So he's going to have tonic-clonic seizures, as you can see right now, especially from his limbs, his legs. He's going to have tonic-clonic movements, typical that we can see in grand mal seizures. Now, he's not going to remember a single thing. He's going to forget. He lost his consciousness at this point. Now, imagine this happening under the water. That means that if this is recoverable for a diver who is diving under the water, especially in a military mission, most likely he's going to die. But this is why the Navy wanted to study the phenomenon a little deeper. So they used to study the neurons in the solitary complex. These neurons are responsible for the respiration. Then when I moved there, we started working on the whole animal physiology. So we moved from brain slices and cells taken from the brain slices to whole animal physiology, and we implanted these radiotelemetry modules in Sprague-Dawley rats. These radiotelemetry modules were able to give us real-time measurements in electroencephalogram, electromyogram, electrocardiogram, physical activity, and body temperature before, during, and after a dive. So we might have, comparisons, reliable comparisons of physiological markers during a dive. Just to show you, give you a quick idea of what a rat having seizures looks like, you could have a glance at the right panel. This rat is going to have seizures, going to have tonic-clonic movements of forelimbs and head, as you can see. He's having seizures. So at this point, he's having CNS oxygen toxicity seizures. So this is a set of data that we used to collect after an experiment, and notably, we published a paper on this, demonstrating that 3 to 5 minutes before the onset of seizures, of grand mal seizures, there were two physiological parameters that would go up, considerably go up. Number one, tidal volume, which is the amount of air that the rat would breathe. And then we have the respiratory frequency, which is the amount of times per minute a rat would breathe. So these two values would significantly go up in pretty much 100% of our experiments. So we published this paper basically telling the Navy that if they felt the respiration going up, that might mean that a seizure was going to happen. But not only that, they wanted to know also how to avoid that. So we started studying a possible option with antioxidants, but antioxidants were very mild. So we moved on to anti-epileptic drugs like carbamazepine, phenobarbital, But as you can probably see, these drugs have a lot of side effects. So they might actually be more detrimental than beneficial. So we decided not to go on that path. The best option at that point would be starvation ketosis, which is pretty much when we are in a ketosis, because this has a neuroprotective effect on our brain and on seizures. The point is that these guys were on a military mission, and we couldn't put them under stressful conditions under a specific no carbohydrate diet. I mean, that would be pretty harsh. So we decided to synthesize in our lab a non-ionic precursor of ketone bodies that was able to push their ketosis level up to 2-3 millimolar, which is pretty much how we reach after we follow a ketogenic diet for 2-3 weeks, but without following a diet. So the ketone ester was able to do all this and instantly, like in 30 minutes. So our hypothesis would be, would this ketone ester able to prevent the seizures still happening in our rat? So let's step back a little bit just to discuss about what a ketogenic diet is. Ketogenic diet is a diet made pretty much of fat, 75% of fat, so a hyperlipidic diet. But we also have a normal regimen of protein, which is about 20%, and only 5% carbohydrates. Of course, there are many different ketogenic diets, but mainly this is pretty much the scheme we want to follow when we are on a ketogenic diet. What can we eat during a ketogenic diet? We can have fish, any sort of meat, nuts, butter, olive oil, eggs, and so forth. In this way, we're going to decrease the amount of blood glucose in our circulation, and we're going to decrease, as a matter of fact, as a consequence, also the insulin. But what is the optimal level of ketosis for our body? Well, according to Volek and colleagues, who was one of the very first groups to publish a paper on this topic, the optimal range is in between 2 and 5 millimolar. Below 2, that'd be a good value. I mean, that might mean also ketosis, even though if it's not deep ketosis. And after 5 millimolar, we are getting closer to 8 millimolar. 8 millimolar is the cutoff value after which we should, be concerned, because we might get into ketoacidosis. But as long as our kidneys and our liver work well, we shouldn't get into that. Anyhow, what are the benefits of being in ketosis? There's a lot of metabolic benefits. First of all, a decreased central fatigue. Then we have enhanced brain metabolism, decreased reactive oxygen species production, but also an increase in biogenesis of mitochondria. But also we have less lactate in muscles when we exercise. You might think that this is a new approach. This is actually not a new approach. In fact, since 1922, we had very first divulgative article describing how the Johns Hopkins Hospital in Baltimore for pediatric patients was able to put their children in ketogenic diet to avoid them to undergo a number of epileptic seizures. And these guys were able to completely fight against epilepsy in 1/3 of cases. Another third of cases was significantly affected because they could reduce their medications to only a few, and the dosages were progressively lower. And the last third was actually not affected by the ketosis. So there were good results at that point. So we're talking about 100 years ago. Now, it didn't get too famous because it didn't really generate too much interest. So it's been there, but not many people knew about it. And it is not even the very first report about ketosis. In fact, we're talking about Hippocrates in 400 before Jesus Christ, when he described the possessed people by the devil. And these people, of course, were not really possessed but they were in some way affected by a neurological disorder, most likely epilepsy. So back in the days, there was no diagnosis of epilepsy, so people might think that they were possessed by the devil. These people were put in isolation for a few days, and magically after those days, they would just come among people with having no more symptoms of epilepsy. This was ketosis, basically, only water, just drinking water. But if you want to have a a good idea and a better idea of what ketosis does to our body, I would strongly suggest you to go read this comprehensive review from George Cahill from 2006. Anyhow, back to our work, we gavaged our animals into the stomach, intragastrically, with the ketone ester, and we were able to check, to see that their resistance against epilepsy increased of about 600%, a little less than that, 574%. That means that if a rat would seize after 10 minutes the first time, if we gave them the ketone ester, they would resist not 10 minutes, but 60 minutes, 1 hour. That is impressively higher. And we have observed that for a high number of animals. So on top of that, so we published this paper in 2013, and then we found that among the 3 ketone bodies that we all know, which are beta-hydroxybutyrate, acetate, and acetone, this latter, the acetone, was the most responsible for the anti-epileptic activity, or if you want, the neuroprotection. Then, always in 2013, I moved back to Italy and I started working with Dr. Vitone and Dr. Coppola, two of the most famous people in Italy to work on epilepsy and the ketogenic diet. We have been working on another model of epilepsy called the pentylenetrazole. We wanted to check if the ketone ester was able to increase their resistance against seizures, even in this model, and it did. In fact, the result that you can see here, it explains that there is a considerably higher resistance against epilepsy induced by pentylenetrazole. So we published 2 papers on this topic, respectively in 2015 and 2016, describing how ketone ester was able to reduce or cancel, pretty much cancel, grand mal seizures. Anyhow, moving on, what are the neuroprotective and not only neuroprotective effects of ketones? There's so many. It all got famous with the Atkins diet when people needed to lose a lot of weight, especially bodybuilders, but also later on in obesity. So, of course, if we take off sugars out of our diet, we're going to consume at some point our fat reserves. So this is why we lose weight. And we lose weight, if you want, in an ancestral way. But then we also have a lot of neurodegenerative diseases, such as Alzheimer's disease, Parkinson disease, Lou Gehrig disease, also known as amyotrophic lateral sclerosis, but also traumatic brain injury, and so forth. Not only neurodegenerative diseases, where ketones look to be some sort of protection providers for the neurodegeneration, but also in cancer patients. One of the most affected cancers by the lack of glucose is glioblastoma multiforme, together with a number of other brain cancers. Glioblastoma multiforme is one of the most aggressive brain cancers, but it is very highly sensitive to the lack of glucose. So we've been, the approach is pretty simple. In healthy conditions, we're going to use our sugar. Now, as we finish the sugar, the circulating sugar, we're going to attack our fat reserves. As a matter of fact, only gluconeogenesis at some point, if we do not introduce any exogenous sugar, only the gluconeogenesis is able to produce a little amount of sugar. But this is not enough to satisfy all the needs, all the glucose needs of the body. So at some point when we have no more sugar to go, we start attacking our fat reserves. And that's there that mitochondria show their capability of adapting to ketone bodies. And in this way, we start consuming our fat reserves. But in cancer cells, this metabolic adaptation is not present. Most of mitochondria are not able to adapt to ketone bodies. And this is why if we pursue this approach, we're going to have a selective nutrition towards healthy cells. So just moving faster. As I moved to Italy, I needed some sort of partners that would help me keeping the patients I would suggest to be on a ketogenic diet on a ketogenic diet, because these people were very much attached to their pasta food, like bread, the pizza, or fruits and so forth. So I needed something to give them to mimic what the bread would do to their taste, but it didn't have the same, macronutritional values. So I found this company called the Gambaro Ketogenic Food that was able to produce pasta, pizza, bread, and so forth, even desserts, but with very low amount of carbohydrates or no carbohydrates at all. And we started working together to the point that we have been accomplishing a number of good results at the scientific level too. Then I've been publishing a number of videos on YouTube explaining people how they could be, how could you get benefits out of a ketogenic diet. Then I published a couple of review articles, always talking about this topic. And on top of that, with Le Gambari Food, we've been struggling a little bit from a bureaucratic perspective, and we obtained the authorization from the Ministry of Health, thanks to which we're able to provide GLUT1 patients and epilepsy patients with this product for free, which is a great, I believe, one of the most significant results we've ever had. I'm going to show you very quickly a few patients that I've been in touch with to reduce their glucose levels, to put them on a ketogenic diet, and to see actually that working. Patient number one is Marco, 63 years old. He had prostate cancer. He was put on a mild ketogenic diet for 2 months at the beginning. And this prostate-specific antigen, the PSA, went from 162 to just below 1, which is a great result. Then he's been on a ketogenic diet for 2 years, and his PSA went even below 1. There is no cancer evidence, no cancer recurrence after his PET scan, and his blood glucose is stable as well as ketone. Then let's talk about Mario, 66 years old. He had pancreatic cancer. He was put on a strict ketogenic diet. His cancer antigen went from 43.69 to 9.84 unit in milliliter in just 1 month. He's been over 2.5 years on a ketogenic diet. He's feeling well, and there is no evidence of cancer recurrence. We also have Michele, 47 years old. He had glial lesions, cancer, and brain cancer. He was put on a strict ketogenic diet, and he has shown glial lesions extension, so a reduction of glial lesions, of tumor mass, and of the edema. We also have Matteo, 45 years old. He had stage 4 colon adenocarcinoma. He was 1 year and 3 months on a ketogenic diet, a very strict ketogenic diet, and he's been working on that for a long time. He had a consistent reduction of adenocarcinoma lesion. We also have cases of glycogenosis with Luca, 25 years old. After a mild ketogenic diet, he was able to go back to exercise and work, and he had no more spasm of pain, which is already a great result. Then finally, we have Giancarlo, 43 years old. He had a glioblastoma multiforme, and he was put on a strict ketogenic diet. He was able to, show no evidence of tumor mass after 1 year on a ketogenic diet. Then I would like to mention Dr. Anna Tagliabue, who's been organizing a number of classes of courses for registered dietitians who want to use the ketogenic diet to follow people with pathologies. So it has a very high value. She organizes this course once per year, not 2020, and probably, I mean, we don't know about 2020, but since then, since 2019, every single year there has been one. And I mean, they're very important courses because practically you can start learning what you're going to use. And last point of my presentation is to briefly discuss with you the possibility and what we actually did of curing early stages of Parkinson's disease with ketosis. There is not much in literature. We can find that what is responsible for the neurodegeneration in Parkinson's disease is called MPTP neurotoxin. And then we know that the beta-hydroxybutyrate is one of the molecules that contrasts its activity. So thanks to beta-hydroxybutyrate, we are able to considerably slow the process. So there are many papers pretty much stating the same thing, as you can see here, and you're not going to find very much in the literature. But just because physicians do not want to take the responsibility of getting their patients into constipation, because as you know, ketogenic diet has mainly two side effects. I mean, there are others, but the most important ones are constipation and osteoporosis, but they're both contrastable. They're both solvable. So we started on a study on early patients, Parkinson patients, in Villa Margherita Neurological Institute, and we had the intention of going 3 months on a ketogenic diet, but we only could go 1 because then COVID-19 kicked in and we weren't able to finish our study and our data collection. Anyhow, we got some data, and this is very important. We wanted to realize if there were any differences in between, before, during, and after a 3-month ketogenic diet. So we analyzed speaking abilities, their facial expression, their general tremor rest, their postural tremor, their leg agility, their stability, and so forth. The non-motor symptoms that we analyzed were the autonomic dysfunctions, sleep troubles, neuropsychiatric disturbances, and other troubles. And the tests that we've been using were specifically the G-Walk BTS, the time up and go, and the 10-meter walking test. These tests are very specific for Parkinson's patients. So we've been analyzing their mini-mental state examination, their memory, their frontal functions such as phonemic fluency and the semantic fluency, their capability of talking. Just to give you a quick idea of what we did, in this video, you see a physician indicating a pattern to follow, a path, sorry. This path needs to be followed the same way by the patient. And in this other video, you're seeing that the patient has to pick the perfect match, and in terms of pattern, and you will. I mean, it looks like simple, but it definitely is not for those patients. Then the data were collected. So in the end, we wanted to analyze their cognitive performances, their cognitive decline, their motor and non-motor condition. And our data are not too, we couldn't analyze, we couldn't collect a lot of data because of COVID-19. But what we found was that they had something very similar and in common with this study published by Dr. Phillips from New Zealand in 2018. And notably, Dr. Phillips put 47 patients, of whom only 38 completed the study, on a ketogenic diet for 2 months. And he had decreased after this long period of 2 months, he had a decrease in urinary problems in his patients, decrease in pain, a decrease in fatigue, a decrease in daytime sleepiness, and a decrease in cognitive impairment, which is the most important thing. So he also demonstrated that the ketogenic diet is definitely safe to be followed for a longer period of time. So in line with them, our results show that our patients showed a very marked decrease in urinary problems. So there was an actual good results about it. And last but not least, we need to mention what we do for Parkinson's patients every year, not 2020 because of COVID-19. But we organize what is called the Run for Parkinson's. We get together with the patients and we walk for a brief distance, for a short distance. Our next step is definitely to apply the ketone ester on the Parkinson's patients because there is no need to follow a ketogenic diet, which might be difficult to comply with. The Ketoforce is already on the market in the United States. That might be, useful for other forms, or that might be useful for a number of things. So, finally, I would like to thank the Italian GLUT1 Deficit Association. It has been helping me a lot, as well as the reconnect.org website, which connects all the people affected, or their parents, or their relatives, with other relatives having a patient in their family with a rare disease. This is very important because getting together on board means to have more chances to get the problem solved. And then I have to thank Dr. Casimina Chisano. She's been helping me a lot with this amount of pathologists. And last but not least, I would like to show you 4 movies that might be of high interest if you like this topic. Number 1 is Fed Up. This explains how bad sugar can be. for us, especially in the United States. In fact, they predict that in 2050, 1 out of 3 patients will be diabetic type 2. This other movie called That Sugar Film is from Australia. The main character undergoes a number of tests just to show people how blood work changes according to what we eat. Here we have The Magic Pill, an American movie again. This movie explains how people might modify their diet, and this still, put the emphasis on how this can be the key process to control our health status. And this is the last one. This is a homemade movie. This made me think a lot. Butter makes my pants fall off, which is pretty much the story of this guy decreasing his weight by consuming very high fat food, and just that, no sugar. So again, thank you very much to my colleagues from the United States, from those from Europe, from Italy, and thank you very much for your attention. If you have any questions, please do not hesitate to ask.
Okay, thank you, Dr. Pilla.
Thank you.
Thank you, Doctor.
Thank you.
Okay, you can reach Dr. Pilla by his email that is in the chat room.
Yes, it is also my PowerPoint presentation, which is no longer on the screen. But yes, thank you very much for reporting that.
You're welcome.
You're welcome. Thank you so much.
Thank you.
Okay, so if no one has any questions, we move on to our next